I want to show you why I would use the skin as my first targeted tissue before looking at muscles, before looking at structures. So what did I say about the skin for sympathetic, parasympathetic? Which way engages a parasympathetic response? Away from the brain. And sympathetic would be towards the brain. I want to show you how effective I think the skin can be in care. Can you move your arm in a painful way and stop before the pain occurs? So, does this hurt? This reaching behind? Right there. Okay, now where is the pain?
In the front.
On a 1 to 10 scale, 10 being I gotta go to the hospital, 5 being you make a grimace, you're making a face, 0, there's no pain. What would you give that?
When I'm moving it?
When it's in the painful spot.
A 6.
A 6. Okay, even though you didn't make a face.
Mm-hmm.
You're controlling yourself?
Mm-hmm.
Okay. Now, what I'm gonna do is I'm gonna take the skin and I'm gonna move the bicep, you can relax your arm fully, into a parasympathetic space and her tricep into a sympathetic. So away from the brain, towards the brain. Just gripping the skin. Not enough pressure to really affect tissue and maybe 30 grams of pressure. Now you're gonna move, I'm gonna move with you. Stop when there's pain, tell me if it's better or worse.
Better.
And bring it back down. By how much? It was a 6 previously?
Probably 5.5.
Okay, so not enough of a change for me to feel a difference. So now what I'm gonna do, I'm gonna stand here, so sorry if you can't see. I'm gonna move her pectoral tissue into parasympathetic, away from the brain, and I'm gonna have you do the same thing again. And come on back down. Any change, better or worse?
Not really much of a change.
Okay, same thing here. I'm gonna do, you can relax, don't worry. I'm gonna go under your shirt, is that okay?
Yep.
So I'm going under her shirt so you guys can see. Normally, I would just have her skin exposed in my clinic. I'm on the serratus, and I'm trying to bring it towards her rib cage. Move your arm again for me. And bring it back down. Any different?
Yes.
Better or worse?
Better.
How much?
I would say like a 5.
Okay, and I'll go in the other direction.
Same.
Okay, and then last one, face them again. What I'm gonna do now is I'm gonna approximate the tissue together. Try it again.
Already feels better.
Okay, and try it again. And bring it back down. What was that one?
Like a 4.5.
Okay, so I'm using that was maybe 10 grams of pressure, a little bit more because she had to move, but I brought the 2 pieces of skin towards each other to decompress the tissue beneath it. I didn't do anything muscle, I didn't do anything joint, I didn't do anything ligament or tendon. And I didn't do fascia. I just literally did the amount of pressure it takes to move the skin, and I tried to take pressure off her pain site. And her symptoms went from a 6 to a 4. That's a pretty big change. 6 is grimace, grimace is guarding. 4 is I'm not guarding, it's uncomfortable, but it's not painful anymore. That's a really significant change. So that tells me treatment-wise, the first thing I should be focusing on treatment-wise is bringing the skin together. Decompressing tissue. That's it. I'm gonna do more stuff as well, which we would do throughout the weekend, like get into the connective tissue and the muscles and the joints. But my starting point, I got her out of a 6, which means now when I go deep into those muscles, she's not gonna be fearful of movement or treatment because she's already gonna be down at a 4. Does that make sense? Mm-hmm. That's how I'll use skin as part of my assessment treatment before we even start deeper care. Okay, and it's looking at where that unhealthy skin is and trying to find it. She told me that's pain, so I don't have to think about unhealthy skin or not. I can simply focus on it specifically. And I started with what I thought was most probable, parasympathetic. She says here, chances are biceps tendinosynovitis, biceps tendinopathy, highest probability for her category, her age, her job. Doesn't mean it's not labrum, it doesn't mean it's not other stuff, right? So then after we do the skin, right, which we're gonna do some more of, I would then go into connective tissue. We're gonna go into fascia later, and ligaments and tendons, and then I would go into muscles, and then I would go into exercise, and then she would leave the office. And that's how we start with the skin.